Hi there, this is Dr. Balanoff, and today is April 15th. Normally, tough day for all of us. We have to pay our taxes, but kind of interestingly enough, even a tougher day because all of us are sitting around thinking about and planning when we want to open our office and how we're going to do that. So let's talk about the soft opening of your dental practice. Now, what I've done for you is I've put together a lot of ideas from a lot of dental practices that have kind of interacted with me over the last couple of weeks, what their plans are, and I created this hybrid list of probably the best way forward for all of us opening our dental practices. So before you start writing down a lot of notes about everything I'm going to say, know that all of this information is available at smileperfected.com. There's going to be a separate document there. It's going to say COVID-19, and you're going to be able to take all of this information and go through all of it and decide what's best practices for you. Generally speaking, here's the challenge that we're all going to have opening our dental practices. When patients want to come to see us, and they do want to come to see us, they're desperate to come to see us, the first thing that we need to be able to do is to convey very visually that we've done everything possible to make their visit to our dental office as safe as possible. So all of the things that I'm going to be talking about here, all of the things that in more detail that are available to you at smileperfected.com are to create this safety that our patients want to feel when they come to visit our dental office. Now, that safety is best defined by us being patient with the patients. We can't rush the visit, we can't rush the interaction, and we can't do it for a lot of different reasons. So let's start talking about the list of things that we need to do to convey safety. Now, a lot of the dental associations and a lot of the boards of dentistry of the states of where we, practice our dentistry have different rules and different recommendations and different guidelines. Some of them are a little bit paradoxical. Some of them make sense. So initially it was only treat emergency patients, those with an infection or somebody who was really in a lot of pain. And then a lot of the organizations started talking about urgent care. And urgent care, some organizations try to define it, but in my opinion, as a dentist responsible for my patients, I feel that urgent care is a little bit more broader. Now, for the next week or two, I do agree that emergency patients and urgent patients should be the ones seen. But in my opinion, patients that have been in a temporary for many weeks, if not a month or two by now, need to be seen. That becomes urgent dentistry. What I worry about is recurrent decay or some other problem with the dentistry that I did a month or two ago on these patients. Those patients are urgent and they need to be seen. There are a lot of patients out there whose periodontal conditions predispose them to heart disease and stroke and exacerbates their diabetes. Those patients need to be seen. That urgent care, that hygiene visit is something to that patient's overall health. So what I'm doing is I'm taking the recommendations from the states and I'm going to start to define urgent as I see fit as a doctor kind of going forward. And I think when you think about that for a second, the difference between emergency care, urgent care, and what we would call, not us as dentists, but what the public would call routine care, I think those three silos are going to be better defined by understanding that urgent care, a lot of our patients are urgent, more than the average public person understands. So please, let's prepare for the soft opening. Let's go through all the guidelines here to start treating those patients who certainly require care and urgent care because they just need to be seen. So let's talk about dental procedures first, the urgent dental procedures that need to be done. Finishing up the patients we started a month or two ago, taking care of patients' decay, doing the things that we know that are urgent to keep our patients healthy. Remember, it's about the perception of safety. Now, I know all of us are going to be very safe. There's not a doubt about that. So what does safe mean? Safe is the PPE, the personal protection equipment. And I have all of this written down, so please don't take any notes. You can go to our website. Mask, gown, gloves, face shield, and another recommendation I'm going to make is shoe covering. The little booties that you would wear if you were going to an operating room. Now, a lot of offices are going to say unnecessary, silly, but remember, it's about the perception of safety. And if our patients see us fully garbed with booties on our feet, they're going to know that we care, we've gone above and beyond to make sure they're absolutely safe when they come into our dental office. So when it comes to our dental procedures, what do we want to do? So if normally a dental procedure takes an hour, my recommendation to you in the beginning, certainly for the soft opening of your dental practice in the next couple of weeks, is to add another 15 or 30 minutes to that appointment. During that time, you're going to explain to your patient what you've done, why you've done it, why it's so important, how you're trying to make sure that they're nice and safe. So when it comes to dental procedures, add another 15 to 30 minutes. For hygiene, and in hygiene, a lot of these patients are urgent. They need to be seen on a very regular basis to avoid gum infections. So what I've written down here is I recommend, as opposed to seeing one patient every hour or one patient every 45 minutes, I recommend that you see one patient every 90 minutes, maybe 75 to 90 minutes. So add an extra 15 or 30 minutes to the hygiene visit. Now, one thing that's not typically done in hygiene is having a high volume evacuation suction eliminate all the aerosol from a cavitron or piezoscaler. So one of the things we want to add to the hygiene protocol is adding a dental assistant in the hygiene room to help with the suction to avoid a large aerosol spray in the field of which we're working. So we're going to be using the piezo, we're going to be using the cavitron, it creates an aerosol, have a dental assistant there suctioning. And then that dental assistant's going to help clean the room afterwards. So when it comes to treating patients, add more time in the beginning to kind of get the routine of how this is all going to work out. And the next steps we're going to follow are going to explain why that additional time is going to be necessary with the way we need to manage patient flow. So how does it all start? Well, we need to appoint these patients. And when we appoint our emergency and urgent care patients, let's talk about the procedures and protocols that we have in place. And on that confirmation call, ask the patient if they've had an elevation in their temperature or they've experienced some of the sickness or some of the signs of the COVID-19 virus. And if they have, then you have to suspend that treatment. If the person is sick and they're in an emergency basis where they're in a lot of pain, try and manage it with antibiotics and some type of anti-inflammatory. If they truly need to be seen, then I recommend seeing those patients and only that patient in the office and making sure that everything is going to be clean after the patient leaves. So you're not going to double book that type of patient. So let's go through some of the individual steps of when a patient arrives to your dental office. So we're going to back up just for a second. Arriving to the dental office doesn't mean they're walking into the front door and they're having a seat in the reception area. That no longer happens. What you're going to tell your patient at the confirmation call is when you arrive in the parking lot of the dental office, you're going to call us. You're going to say that you've arrived. And then we're going to tell you when it's safe for you to come in. And what does safe mean? Safe means when there's nobody at the front desk and there's not going to be an exchange or two patients kind of crossing at the front door. So what happens if your minor child needs some dentistry? What you're going to do is you're going to bring the patient to the front door, your son or daughter, the parent or the guardian. The parent or the guardian is going to hand off that child to the dental assistant. The dental assistant is going to take the young patient back. Once the young patient is finished, we're calling up the parent or guardian, saying that the child is finished. The parent's going to come to the front door, get the child, and then go back out to the car. At the end of every single patient interaction, we're going to be introducing a new employee, and it's going to be a sanitation or sterilization technician. And that person's job is to make sure that wherever that patient goes, that area is going to be cleaned. But here's the other thing we're going to add when the patient comes into the office, whether it's a child or it's an adult. The first thing we're going to do is we're going to have that person wash their hands with a hand sanitizer. Okay, and then after the hand sanitizer dries, we're going to give them a pair of gloves for them to wear. Okay, then they're going to be taken back. Whatever dentistry needs to be done, whatever emergency or urgent care dentistry needs to be done, at the end of that appointment, the patient's going to take the gloves off, throw them inside the red box, the disposal box. They're going to wipe their hands again with hand sanitizer and then leave the office. We're trying to mitigate any cross-contamination in any way. Remember, is all of it really necessary? Well, I think so, yes, but a lot of it is give the perception that we're truly doing everything we can to create this aura of patient safety. And that perception is really what's kind of be driving this whole entire thing. So what about payment and next appointments? Well, all of that can be done while the patient is sitting in the car. Okay, so let's talk about the different forms of payment. Cash. We're going to tell the person when they go back out to the car, your appointment, after your copay with your insurance, you owe us $50 cash. Now the person's going to get the $50 out. They're going to walk back to the office. They're going to hand it to the employee who's wearing gloves. The employee's going to take a can of Lysol, spray off the money, and let it dry. Okay? And you can do this in front of the patient. Nobody's going to be offended by the whole entire thing. If it's a check, the patient's going to go out to the car. They're going to fill out the check. They're going to come back, and we're going to spray it again. And we're going to process it, whether it's an automatic check reader or we have to stamp it and deposit business as usual. And if it's a credit card, most of the time we can do all of that stuff over the phone. But if you want to try and lower the discount rate because you want to have the physical credit card there, you're going to take the credit card from the patient through the door, process the credit card, and then hand it back to the patient. That's a smart and safe way, and you're showing the patients you're trying to be as safe as possible. And what about next appointments? Well, the person or the patient is not going to be standing up at the front desk area making their next appointment. They're going to go back out to the car, they're going to call on the phone, or they're going to make that next appointment. So why are we adding an extra 15 to 30 minutes for all of our patient appointments during the soft opening of our dental offices? It's because all of this is so clunky and so long and drawn out, and we really don't know how good the flow is going to be, that we're going to need a week or two to kind of figure it all out. Once we get it figured out, sometime in May, we're going to start to go back to our full-time schedule. We're still going to follow all of the rules that we talked about here, but we're going to start to speed up this process. We're going to start to see more and more patients. We're going to start to see routine patients above and beyond the emergency and urgent care patients that we've been seeing. So we talked about being safe, we talked about the perception of being safe, and not only do we want to have our patients feel that way, we want to make sure that the people that work for us feel this way. So what do we want them to do? We want them to show up for work, ready to work, and they're going to be wearing whatever scrubs or whatever they're wearing, and they're going to be wearing some personal protection equipment over the top of their scrubs, and they're going to see patients all day. What I'd really like to see happen is for them to bring a separate set of clothes with them. So at the end of the day, after all the patients have left, they're going to be able to take off their personal protection equipment, gown first, then gloves, okay? And then they're going to change their clothes from the scrubs they were wearing into some other clothes. The scrubs they're wearing are going to go inside a plastic bag, and then as soon as they get home, they're going to wash those clothes when they get home. So this way there's no cross-contamination between the office and their home life. And that small little step, that step of showing that you care for them, that they care for their family, and we're trying to avoid any cross-contamination of that virus is really the most important thing. So what are the kind of conflicts or barriers to us doing a soft opening coming up in the next week or two? Well, certainly we want to make sure we're following all the rules. We want to understand that with the difference between emergency care and urgent care and routine care. But probably our biggest challenge is making sure that our employees feel safe to come to work and to start to see patients. Everything that I've outlined here is going to do that. But the final challenge is all of us as dentists and dental office owners is to get the PPE, the personal protection equipment, into our offices. The dental suppliers are having a tough time getting it, okay? So if there's going to be a delay, it's going to be a delay because you don't have the PPE. And one of the things that I should be talking about, and I don't really know how important it is, but a lot of people are doing it, is taking the temperature of a patient before they come in. Getting one of those little handheld things where you can take the temperature off of somebody's forehead. Great idea. If you're able to get one, wonderful. Please do it and add that to the protocol before a patient comes in. But those challenges of actually getting the equipment and the PPE, that probably is our biggest, well, I think our biggest obstacle to starting the soft opening. But if you have the equipment and you're able to start the soft open, then let's try and do that in the next week or two. The patients need it, and they need urgent care a lot sooner than later. So where do you get all this information? Where do you get all the details? Where is this all printed out or scripted out? Go to smileperfected.com. It's listed there, and you have all the information. If you want to discuss any of the things, I'm more than happy to chit-chat with you. My personal cell number is 954-683-2693. So smileperfected.com or 954-683-2693. If you want to email me and talk to me via email, it's wbalanoff, BALANOFF @smileperfected.com.